Today's lesson is, when do the symptoms of dementia affect driving? For many, driving is a normal part of life. Most older adults have been driving since they were 16, and some that lived in rural areas have been driving since they were born. Driving gives them a sense of independence and freedom. However, dementia can significantly alter the ability to drive safely and competently. 1 in 3 people with early symptoms of dementia still maintain their license despite this diagnosis. It's important that assessments be done over time to evaluate if safe operation on public roads is possible. Remember, safety should always come first when making decisions about continuing or discontinuing driving activities. With over 5 million Americans struggling with signs and symptoms of dementia, it can be daunting for individuals and their caregivers to decide when the difficult but necessary step to give up driving should take place. As advancements to diagnose dementia and medication improve care options, a person living with dementia is able to stay on the roads longer. This offers hope, but also further complicates an already complex situation. Although there is much advice and warning against driving by a person with dementia, concrete guidance about how or when to stop isn't always provided. A safe driver must possess specific skills to navigate the roads. These skills require focus and attention, visual spatial skills, problem solving ability, and great judgment and decision making, plus fast reaction time when it counts. All this is necessary for avoiding collisions on the road. Not only that, having a good memory helps ensure you get from A to B safely, too. Driving is a complex task requiring focus, patient, and visual spatial awareness. Unfortunately, dementia symptoms can impair all of these skills. This results in drivers with the Alzheimer's disease and other types of dementia needing to stop driving at some point. The different types of dementia affect people differently, especially in the early stages and early signs of dementia. Dementia is an umbrella term for conditions that cause memory loss. Each of these types of dementia have different signs and symptoms in the early stages. As the dementia progresses, the brain changes and cognitive decline follow a pattern. So I'd like to address the different types of dementia and how early signs can affect driving. Let's start with mild cognitive impairment first, MCI. As we age, we start to slow how we process and respond to our environment. Individuals with mild cognitive impairment may be aware that they have memory lapses. They experience memory problems more than other people their age. But these changes aren't bad enough to impact daily life or affect usual activities. I'd like to note here that a person living with MCI may develop Alzheimer's disease. With MCI, you can still maintain your independence and get around safely. The good news is that research indicates that individuals diagnosed with mild cognitive impairment are no more likely to be involved in an accident during the first year or two after diagnosis than without it. Many continue driving successfully for years afterwards. There is a good reason for this. Driving is what the experts call an overlearned skill. 30 or 40 years plus behind the wheel is seared deep into our brain and muscle memory. It is a familiar task that means most of us can continue to access the ability to drive even in the face of some cognitive decline. MCI is a distinct diagnosis from Alzheimer's disease, and the rules for safety driving differ greatly between them. Most patients with MCI can safely drive when taking certain precautionary measures, while those diagnosed with Alzheimer's disease typically cannot continue to operate vehicles unless they are in the early stages of their dementia symptoms. A person developing Alzheimer's disease must be monitored by doctors closely. Medical professionals have an obligation to inform local motor vehicle commissions accordingly. With sensible lifestyle adjustments, many seniors are able to maintain the independence of driving. However, when these changes become more difficult or dangerous, family intervention can help assess the situation and enable a safe transition away from driving if necessary. As Alzheimer's disease and other dementias progress, it is not surprising that cognitive abilities critical to the task of driving may be impaired. A person's symptoms with dementia might struggle from impaired judgment, multitasking skills, slowed reaction times, or difficulty in processing spatial information, all of which can put them at a risk on the road. As their condition worsens due to these impairments and declines in assessment capabilities, they become increasingly vulnerable while behind the wheel, a situation requiring family members' consideration for everyone's safety. Now I want to address driving with Lewy body dementia. Lewy body are proteins that build up in the area of the brain that affect alertness, movement, and other functions. Symptoms can be confused with Parkinson's or Alzheimer's, but the development of Lewy bodies in areas of the brain are unique to this diagnosis. It typically begins between 50 and 85 years old, and it gets progressively worse over time without an available cure, yet treatments exist which help manage the symptoms. It's important to note here that mixed dementia is for some, the brain may have experienced a trifecta of dementia from three different sources. Patients that have Alzheimer's disease and vascular dementia may also develop Lewy bodies dementia, or you get all three of them at the same time. These conditions can occur together in mixed form, characterized by both abnormal protein deposits linked to Alzheimer's, as well as blood vessel issues associated with vascular dementia. I bring your attention to this condition because the signs of dementia affect people differently. Symptoms vary, and common early symptoms of dementia are not concrete. The brain changes occur in different regions of the brain. As brain cells die in different regions, other symptoms and behaviors come to light. The most common warning signs that suggest when it might be time for an individual driver with Lewy body to give up driving are muscle stiffness, as well as common symptoms such as hallucinations. Individuals that receive a diagnosis of frontotemporal dementia or early onset dementia have characteristic erratic behaviors. These behaviors are not conducive to driving. So let's address other medical conditions that affect driving. Dementia and its associated symptoms can have a serious effect on an individual's ability to drive safely. Issues such as vision, hearing, or muscle weakness may inhibit their physical coordination necessary for maneuvers, like pulling out onto moving traffic. Additionally, certain medications used to help treat dementia-like symptoms, including some drugs for depression and sleep aids, could be reported to the driver's license agency in order to avoid any potential safety hazards on the road when driving with this type of impairment. Of course, a person with dementia is not able to assess their capacity to drive. They may be able to complete familiar tasks, but suffer from poor judgment. So let's talk about the challenges of taking away the keys. Caring for a loved one with dementia brings many complicated challenges. One of the greatest is dealing with driving and how to ensure safety on the road as impaired judgment and new symptoms develop gradually. The older adult's abilities diminish over time. While early diagnosis and early treatment can help extend independence, it remains critical that caregivers are responsible for monitoring their family members' ability to stay behind the wheel. Then making the difficult decision regarding when to end or limit this right must be made in order to protect them from serious loss or injury. Family caregivers must consider the risk factors as memory problems and other warning signs present themselves. As dementia progresses, it affects the skills needed for driving even more. This means every person living with dementia will eventually be unable to drive safely. How quickly this happens vary from each person with dementia. So let's talk about planning ahead for the day when you, as a family caregiver, will have to take the keys away. Planning ahead will entail having a conversation about retiring from driving before it becomes an issue. I recommend that you take the Caregiver Relief Elder Care Communication course lesson on driving and retiring from driving to give you a detailed approach to this topic. Opening up a dialogue about retiring from driving can be an emotionally charged issue. Instead of avoiding the sensitive subject, try approaching it in a sympathetic manner with your loved one's best interest at heart. Show them that you are dedicated to looking out for their safety and well being while still preserving their independence as much as possible. Reinforce that they're making this decision not just for themselves, but also others on the road. Do this by presenting facts backed by professional advice. Consider inviting your physician or another healthcare provider into the discussions if it's necessary. Getting your physician involved when addressing the issue of driving with your family member living with Alzheimer's disease or other types of dementia can help. Rather than trying to have a difficult conversation alone, ask them for support in having a joint discussion as well as providing written instructions that remind everybody what has been decided on. If needed, you can also seek assistance from an objective third party. This may be necessary if discussions become too emotional or challenging during these situations. Remember that it could take several conversations before coming up with the best resolution, so don't hesitate to address this topic again and again until all parties are satisfied. As dementia progresses, family members and caregivers should be aware of potential issues with complex activities such as driving. To ensure the highest level of independence remains for those affected by dementia, I recommend you schedule a comprehensive driving eval from an occupational therapy professional who specializes in driving rehabilitation. This process will provide insight on how well your family member can manage their vehicle safely while offering appropriate strategies tailored to your family member's needs. This might help reduce risk associated with the early stages of dementia related to changes when behind the wheel. I suggest you contact the American Occupational Therapy Association for more information about specialist resources available in your area. Oh, let's talk about when you meet resistance. Transitioning away from driving due to memory loss and insight issues caused by Alzheimer's disease and other types of dementia can be a difficult process for some. But with patience, understanding, empathy, and firmness, you will get through it together. Appeal to your family members' sense of responsibility in order to talk about this change without coming into conflict. Involving an authority figure or trusted friend may help reinforce your message too. And if all else fails, you're going to have to get creative on how to keep your family members safe, as well as others that share the road. So here are some suggestions. Consider ways to distract your family member with dementia from driving. suggest that someone else should drive, make up excuses such as the road is closed, that there are detours in unfamiliar areas, driving conditions are dangerous, or you just want to give them a chance to sit back, relax, and enjoy getting out and about and not deal with the traffic. Consider having another person to sit in the back seat to distract your family member while someone else drives. If the dementia is in the middle to advanced stages or there is a history of sudden mood changes such as anger or aggression, it's best not to drive alone with them. If the person living with dementia wanders or they have trouble finding their way, they can also do so by car. Consider enrolling them in a wandering response service. There are a variety of different medical alert systems to suit your budget. Don't blame yourself if difficulties arise. These challenges are part of caring for a person living with dementia. Oh, I want to talk more about suggestions on planning ahead. As you are planning ahead, it is important to make plans so that your family member with dementia can continue to enjoy the social activities, hobbies, and are still able to get to the hairdresser, church, or doctors. Ask family and friends to help. I have several family caregivers that have a family member with dementia that goes to AA groups. Other family caregivers have church members take their loved ones to services. Explore senior transportation services that are available in your area. You may have to go with your family member a few times until they get familiar with the system and feel comfortable to take the transportation systems by themselves. Navigating transportation issues for a family member living with dementia can be exceptionally challenging. Depending on the roles and relationships between members of the same household, decisions about driving may differ greatly. From adult children interfering on matters of safety to caregiving spouses withholding information in order to protect their loved one's dignity, or another party avoiding confrontation altogether. Ultimately, understanding each individual's unique feelings around this difficult topic is key when navigating any familial conflicts that arise. In my elder care communication course, I have a lesson on having a family meeting. You may want to take that lesson to help guide you when you address retiring from driving. Making decisions about driving safety can be especially tricky for family caregivers. Their responsibility is to ensure the safety and well being of all involved. But it's also important to recognize that everyone handles difficult issues differently due to their unique backgrounds and experiences. To help minimize any friction between conflicting points of view on a sensitive matter like this one, try opening up conversations with factual information from observed behaviors. Focus on what each person brings in terms of knowledge or experience so they feel heard and appreciated. I suggest a family caregiver get in the car with the family member that may have dementia and observe their driving skills for yourself. Here are just a few things to look out for as they drive. Are they drifting into other lanes? Are they straddling lanes? Are they making sudden lane changes? Do they ignore or miss stop signs or traffic signals? Do they have increased confusion while driving in traffic? Are they suddenly braking or stopping abruptly without cause? Do they accelerate suddenly without reason? Do they drive significantly slower than the posted speed limit or general speed of the other vehicles? Are they backing up after missing an exit or turn? Are they having difficulty reacting quickly or processing multiple stimuli? Now, do they have problems with back or neck flexibility and turning to see traffic hazards around the car? Are they getting lost or disoriented easily, even in familiar places? Are they failing to use turn signals or keeping signals on without changing lanes? Do they have increased close calls or near misses? Have they received two or more traffic citations or warnings in the past 2 years? Have you noticed dents and scrapes on their car or on surrounding objects where they drive and park at home, such as fences, mailboxes, garage doors, and curbs? I suggested earlier that your family member with dementia have a driving evaluation. In fact, it is really something all older adults should consider. Almost anyone can benefit from a comprehensive driving evaluation conducted by a professional. The key is to find out about your driving strengths and weaknesses and put recommended strategies in place to continue to allow you to have the ability to drive safely. If you are worried about a loved one safely while they are on the road and they refuse to get driving assistance or an assessment, contact your local Department of Motor Vehicles or DMV. Provide their name as it appears on the driver's license, date of birth, driver's license number if you know it, current address, and how you believe that this person is an unsafe driver. Example, related medical conditions or recorded incidents. If desired, in some states, you can remain anonymous and reports can be submitted. However, not all will accept such requests without confirmation from the submitting party. I'm Diane Carbo, RN with Caregiver Relief.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.